Today's topic is the Fibrous skeleton of the heart. It is included in our curriculum, and it is important for the cardiothoracic surgeons while doing the wall replacement, and it is very important topic for them as well as you. What is wall replacement, how they suture and all, where they suture and all. You should know what is exactly done in that and where they suture. So the muscles of the skeletal muscles are attached to a bone. Right? Smooth muscles, they are surrounding the, which is present in the tunica media of the blood vessels, right? Then in smooth muscles, they are also present in the GIT and gastrointestinal tract and genitourinary system. They are also spindle shape, and they are along with the wall. So they have their support. But what about the cardiac muscles? The cardiac muscles are the muscles which are attached to the fibrous tissue of the heart. Cardiac muscles are the muscles which are attached to the fibrous tissue of the heart, and this fibrous tissue is stronger, which is present in the heart. That's why it is called as fibrous skeleton of the heart, which is strongest tissue which is present in the heart. So what is fibrous skeleton? Fibrous skeleton of the heart is the fibrous tissue which is present in the heart, which gives attachment to the muscles of the heart, that is atrial as well as ventricular musculature, that is cardiac muscles. So clear this idea? The fibrous skeleton is nothing but the fibrous tissue which is present in the heart, which gives attachment to the muscles of the atria and the ventricles. Right? And they are present along with the walls, that is right and left atrioventricular wall, that is mitral and tricuspid wall, and also the pulmonary and aortic walls, and they are as called as annulus, that is they are inverted U shape. There are many, 3 inverted U shape fibrous tissue which is present along the. इसके बाद में दूसरा एक क्विज है, ओपन क्विज है तुम्हारे लिए, and it will be by Anil Tendulkar. He is the famous cardiothoracic surgeon. So I am going fast. So in your curriculum, what is this? क्या है ये? Competency कौन सा है? Fibrous skeleton of the heart. So you must know what is fibrous skeleton of the heart. Then functional importance. Functional importance क्या है उसका? For suturing, and which is very important for the cardiothoracic surgeons. Cardiac muscular arrangement कैसा रहता है? Conductive system of the heart. So heart interior, all of you know. So this is the right atrium. Right? This is the right atrium. This is right ventricle. This is left ventricle. It shows. What is this? This is the annulus. This is the annulus. This is the annulus. That is the wall, mitral. All these walls are nothing but the part of the fibrous skeleton of the heart. So fibrous skeleton of the heart, if you see from above at the 30-degree angle, if you take a section, it shows 4 rings. These 4 rings are nothing but right atrioventricular wall, left atrioventricular wall, then aortic annulus and pulmonary annulus. Pulmonary annulus is connected with the conus ligament, and this is the right trigone of the heart, and this is the left trigone of the heart. This is the complete diagram of fibrous skeleton of the heart. And from here, there is one small tissue, small fibrous tissue which goes downwards, that is called as membranous septum of the heart, and tendon of Todaro, which forms the one of the boundary of the triangle of Cox. But this triangle of Cox is not described by Cox only. There is other paper is there which is not described by him. Somebody else has written that Cox has been described this, but since from 77 or 67, it has been continuously said as this is described by triangle of, this is described by the Cox, and it's called as Cox triangle, which forms a triangle where what is present here. So functional importance of the cardiac skeleton provides attachment to the atrial and ventricular mass. Now it shows 4 rings, that is the mitral, tricuspid, aortic and pulmonary annuli. So this annulus is like this. So this is ventral, this is ventral, this is dorsal. Anterior, this is anterior and this is posterior. So aortic annulus, it shows three scallop lines. Aortic and pulmonary annulus, it shows three scallop lines. And there is a trigone is there, that is called as right trigone, and this is the left trigone of the heart. This is the right trigone of the heart, this is the left trigone of the heart. This is right atrioventricular annulus, this is left atrioventricular annulus. This is the conus ligament. So tricuspid annulus is the anterior and posterior phyla coronaria. This is the anterior and posterior phyla coronaria, which is nothing but the extensions from the right trigone of the heart, which goes on its extreme end, and it is divided into pieces, and it forms a complete ring, and it gives attachment to the three leaflets, that is anterior, posterior and septal leaflets, which forms the tricuspid wall. This is the bicuspid wall, the tricuspid wall. Bicuspid wall is connected to the aortic annulus by the anterior leaflet, and this is called as subaortic curtain. In mitral stenosis, these two anterior and posterior leaflets, they comes together, and that forms the mitral stenosis, and there will be a pull of this. What is this called? Subaortic curtain. That's why this is aortic regurgitation. समझ रहे हैं ना? नहीं. So this is the fibrous skeleton, that is the pulmonary, aortic annulus, right and left atrioventricular annuli. So what I have done, this I have dissected the fibrous skeleton of the heart, and up to now 150 fibrous skeleton of the heart I have dissected. Previously in Staff Society I have presented this paper, which has been described previously by Zimmerman, and then afterward I have dissected this, and then I have presented this paper in Staff Society. I have presented this paper, and I have got the first prize for this fibrous skeleton of the heart. What is the aim of this study? Is make the specimen of the fibrous skeleton of the heart. But previously I have made the fibrous skeleton of the heart, and the specimen is इतना छोटा सा था, बाहर ही कैसा, 4 annuli which connected with each other. एक ऐसे बड़े गॉस्पिस में मैंने 6-7 ऐसे बंद करके नीचे डाल दिया, इसमें डाल दिया. 1 महीने के बाद देखता हूँ वो तो साफ हो गया. तो सर्वेंट को मैंने पूछा, अरे इसमें ये था क्या क्या क्या, वो सब कचरा था, फेंक दिया. And then afterward again I have dissected, and then there is a specimen in the museum, that is the fibrous skeleton of the heart. So before that I have presented a paper on fibrous skeleton of the heart. I have done the cardboard model. So this is the aortic pulmonary annulus, this is the aortic annulus, this is the conus ligament, this is right trigone, left trigone, and this is atrioventricular wall, that is the tricuspid, and this is the bicuspid wall. Same this I have dissected. This is the pulmonary, this is the aortic annulus, this is called as anterior leaflet of the mitral wall, and this is the subaortic curtain. So in mitral stenosis, if there is a mitral stenosis, so it push backwards, so subaortic curtain goes backwards, so there will be a leak of blood, and that is called as aortic regurgitation. These are the instruments which this structure is the dissected by the Zimmerman, which shows the aortic annulus. This is the pulmonary annulus, this is the aortic annulus. दिख रहे 3, 1, 2 and 3, this 1, 2 and 3, and this is the right trigone of the heart. This is the membranous septum, and small part is called as tendon of Todaro. See here, this is the anterior phyla coronaria, this is the posterior phyla coronaria of the tricuspid. This is the anterior phyla coronaria and posterior phyla coronaria of the bicuspid wall. So what is fibrous skeleton consist of? Right and left trigone, then aortic and pulmonary annula, right and left atrioventricular annula, and tendon of Todaro, membranous septum, conus ligament, subaortic curtain, which joins and continue as the anterior leaflet of. So this is the diagrammatic picture from the Gray's anatomy. So this is the pulmonary annulus, this is the conus ligament, that is tendon of infundibulum. This is aortic annulus, this is the subaortic curtain, this is left atrium, this is left trigon, this is the right trigon. What I have done, removal of the heart is removed with intact tricuspid, annulus, that is the aorta, pulmonary trunk, bicuspid and tricuspid annulus. To increase the hardness, I have kept it in the formalin. Then anatomical position, heart is kept in the anatomical position and cut, right, from inferior aspect. Then I have cut from inferior aspect to the apex, up to the base. So can you see this? This is the ventricles and this is nothing but the clotted blood. You can see this is which ventricle? It's seen from this is the right or left? Inferior aspect. Huh? Now here you can see from inferior aspect I have cut what? This is the interventricular septum. This is the interventricular septum and here whatever you see this white structure is nothing but the membranous septum of the heart, which is nothing but the extension from the right trigon of the heart. This is the membranous septum. This is the interventricular septum. So this is the pulmonary annulus, this is the aortic annulus, this is left atrioventricular, this is the right atrioventricular, and this is what? Can you see this? Conus ligament, that is the tendon of Todaro. Now, dissection from the superior aspect, I have cut the left atrium, right atrium by keeping the scissor in superior and inferior vena cava. This is superior vena cava, this is inferior vena cava. After that I have got the, what is this? Triangle of Cox. And what is this? Opening of coronary sinus. This is the one of the border. If you pull this part, coronary ka if you pull this part, so here there will be a slight elevation is there, and that is nothing but the tendon of Todaro, which forms the one of the boundary. And here there is septal leaflet, and this forms the triangle of Cox. Now, the left atrium is cut by keeping the scissor in the superior, that is the two pulmonary veins, that is superior and inferior. Now this is the atrioventricular, that is the pulmonary annulus, this is the aortic annulus, pulmonary annulus, aortic annulus, and this is the, in between what is this? This is the conus ligament. This is aortic, pulmonary, aortic annulus, this is the right trigon of the heart. And this is subaortic curtain. This is the pulmonary annulus, this is the conus ligament, and this is the aortic annulus. Same picture. इसको कलर किया मैंने. So this is the right trigon of the heart, this is the left trigon of the heart. This is what exactly? This is the aortic annulus, which shows three scalloped lines, which gives attachment from inferior aspect, aortic walls. So this is same. This is the right atrioventricular, that is the tricuspid wall, this is the bicuspid wall, and this is the pulmonary, this is the aortic annulus. You can see same. So cardiac musculature, atrial musculature, it has a superficial part and the deep part. Superficially, transversely, and deep are loop fibers or annular fibers. Ventricular again same, superficial and deep fibers. Now the conducting system of the heart, it consists of SA node, AV node, then the fibers from SA node to AV node. What is it called? SA node to AV node. From where to where, SA node where it is present? At the junction of superior vena cava and So what is it consist of? It consists of sinoatrial node, atrioventricular node, atrioventricular bundle of wheels, then right and left bundle of branch of wheels, then subendocardial Purkinje fibers. So this is SA node. We'll start from here and it goes to AV node, which is present in the left right atrium. AV node is present in the triangle of Cox, then it goes into the interventricular septum. Then in the interventricular septum it shows two branches, that is the left and right branch. There is a moderator band. Here the muscle which is attached to the ventricle directly to the interventricular septum. So what is sinoatrial node? SA node is discovered by Heath and Fleck. It is 10 to 20 mm. It is supplied by nodal artery, that is, it is supplied by coronary arteries, which are right and left. Right, how much? Right and left. Only right or left? Left also. And it interatrial, internodal tract, atrioventricular node, where it is present, triangle of Cox, then discovered by Taura. So here this is the AV node lies, right bundle branch, moderator band, left branch. This is the right branch, left branch. The left branch is right branch, moderator band branch. Purkinje fibers are the fibers which are from right and left branches, which goes to the musculature. So specialized type of cardiac myocytes, three types, that is the nodal myocytes, transitional myocytes and Purkinje myocytes. So the nodal myocytes, they are slow conduction. Transitional is slow conduction velocity and Purkinje are fast. So here this is completely the conducting system and its blood supply. SA node 60% by right coronary and 50% by left coronary artery. Like that the blood supply is there. Atrioventricular bundle, then this is bundle of wheels, then side of the left branch, right branch, then Purkinje fibers. So all the blood supply. So this is the conducting system of the heart. So here prosthetic heart valves is replaced by suturing the aortic and pulmonary annulus in relation with which valve is involved. Pacemaker of the heart is kept on the outside. What is the tachycardia, bradycardia, heart block? How will you confirm heart block? With angiography only. Heart block ECG.